Does this relate to the concept of, I'm going to say, collaborative decision making, which as I understand it, is that you have a discussion with the patient over what they think and you feel is going to be the best technique, which I felt a little bit worried about, because I thought we're always told that just because the patient says, I want my neck manipulated, doesn't mean you do it.
Yeah, that's right. So that's shared decision making.
Shared decision making.
Yeah, that's the one. There's a beautiful model of shared decision making that I really like, and that's what I tend to use in clinic, from Elwyn, that was published a few years ago. And it's around 3 talks, which I'm going to misrepresent and bastardize, and I do apologize, but basically it's about an initial talk, and you understand, it's basically your case history, your chat initially, you understand why they're here, but also what their concerns might be. And then after your examination, you have an option talk. So you describe, that would be your sort of, informed consent chat about the sort of benefits, the risks, the alternatives, what happens if you don't do any treatment. And here you would present maybe a couple of options, that you might be able yourself to offer, which might be, I don't know, some form of hands-on or self-management or whatever, sort of, acupuncture if you do that, whatever. And then there's the something around like choice talk, or there's probably a better word than that, but where the patient is going to say, you know what, I'd like to do this. And that's where the patient might say, I'm 103 and I'd like you to crack my neck because when I was 20, that's what used to work. So you might need to revisit some of the options you discussed earlier. It doesn't mean that the patient is going to decide. It's shared decision. So you bring the evidence, what do we know, what would seem to work, and then the patient say what they would like, and then together we try to work out what's the best option for them.
Right, and so that shared decision making, as I understand it, gets good reviews.
Yeah.
In terms of overall patient outcomes. Is there a placebo effect in there, a psychological effect in there?
Well,
of the patient feeling engaged in the treatment?
Yeah, when we look at the effectiveness of treatment, as I said earlier, there's not a treatment being more effective than another one if we look at pain outcomes. But we do know that if we use a technique that the patient prefers, then the effectiveness is going to be much bigger. So if your patient comes and says, I love manipulations, and you decide, I'm not going to do any manipulations because I'm the boss in the room and I'm going to decide. Well, that's a shame, because you are losing a lot of the effectiveness that you would have got from doing that technique. Obviously, it might be highly inappropriate to do that technique on that patient, and then you need to explain and to discuss. But if we can provide some form of treatment that aligns with their previous positive experiences, then the effects might be contextual, might be specific, we don't know. The effects will be bigger in that patient for sure.